Washington Local Schools has a new place to help families with more than education. Tiffany Ways is here with us this afternoon to talk about the new health center. Welcome. Thanks for being here today.
Thank you for having me.
So it's new, but it's kind of not new because this was a health center that was within Washington Local Schools previously, but you have a nice new office at Whitmer High School, right?
We do. So we opened our school-based health center there in 2023 in our temporary space, and we did construction over the last year, and now it is a beautiful place to call home for healthcare home for our students, staff, and families.
So this is a doctor's office essentially at Whitmer High School, and it's for students, as you said, students, staff, and families. How exactly does that work?
Yeah, so we are able to serve all at the school-based health center. So yes, we call it a school-based health center, but really it is a community health center. We can serve everybody who walks in. So the school gave us a space that allows an external entrance. Okay. So really anybody can come in and get services there. And we are a full primary care office. So any medical needs that the students or families have, we can take care of them right there at the health center.
That's wonderful, because I think many times families are like, oh, I'm having a hard time finding a PCP, or you know, oh, my kid's not feeling well today. So can families make appointments, and you know, what kind of staff will they be greeted by when they're served there?
Yeah, so our health center is open every day, Monday through Friday, and so we have the same consistent staff there. We have a center receptionist who really greets our patients, welcomes them, gets them registered. We do walk-ins or appointments, so either one is good, and we have the same nurse practitioner who is there on a daily basis. We also have behavioral health staff there, so we do believe that behavioral health is really an important part of overall health, and then it's the same staff that are there on a consistent basis. So really taking care of the whole person. In addition, at this location, we do have dental as well.
Oh, wow. So families don't have to worry about a rotating, you know, maybe it's a different, you know, nurse practitioner every day. I mean, they're going to be seeing that same physician when they go in to be treated. So
correct.
Those relationships can be established, huh?
Yes, consistency, relationships is super important, especially when we talk about like adolescent healthcare. We really want to teach our students how to really use healthcare. And so it's that consistency, it's that relationship building that is super important for them, so they can be brave and vulnerable and ask maybe some of the difficult questions that are really hard to ask in adolescence. But there's a staff there that are consistent.
So can students kind of come from class and to be treated, say, hey, I'm not feeling well? How does that work?
Yeah, so the school nurse is still the gatekeeper.
Okay.
So we work really closely with the school nurse, so they are still the gatekeeper. And so the school nurse will kind of triage, see what's going on, reach out to parents. Parents are always involved in the process. And so reach out to parents and let them know they have the option. So we can see students with or without their parents, okay. But we do follow up with parents after to let them know. And we call them down from class. So like, let's say they have a 1 o'clock appointment time. We do call them down from class. We do try to prioritize, you know, your non-tested subjects or your non-core classes to have students come down and be seen. And really the focus is to actually reduce the amount of time that they're out of class, because if you go to a doctor's appointment outside, you're really missing half a day or a whole day of school. And so our goal is just to miss the appointment time and return them back to class if it's not contagious, whatever they're being seen for.
Yeah, so maybe, hey, you may be fine, actually. You got to go back to class. And that's important, because we're hearing a lot about chronic absenteeism in schools, you know, students skipping class. You know, is this a way to help combat that? Yeah,
so we are really able to address healthcare needs quickly instead of a student, you know, maybe they're feeling slightly ill, but then it progresses, so then they have to miss multiple days of school. Or also some students is for mental health reasons, that they're really struggling. Maybe they're anxious about stuff going on at school, and we really are able to address those things right at school and encourage and support what we're doing at the school. And we also work with the school around chronic absenteeism to make sure that we know maybe the students that there's some concern about, that we can also reinforce the message that the school is giving to that student about the importance of daily attendance.
Wow. And as you mentioned, the behavioral health and the dental, that will be included with this as well. Insurance-wise, families can just come in, or they need to have insurance? How does
so we do bill for services. So we do bill their insurance, so regular co-pays apply for our services. However, we do not turn anybody away for the inability to pay. So we are a federally qualified health center, so we have a sliding fee scale and minimal fees for people who maybe are uninsured or underinsured. One of the other things that is a big focus for us is we also do pharmacy deliveries. So the medications are included in that kind of sliding fee scale process, because we want to make sure that yes, we are telling you you're sick, but your medication is also important to be part of that healing process. So we will do medication deliveries as well. And so again, we're a sliding fee scale, and our goal is really not to turn anybody away for the inability to pay.
Wow, so full service there, and this is going to be at Whitmer High School, but it's really, as you said, for the whole district, but for the whole community as well. So Monday through Friday, you said?
Monday through Friday, 7:30 to 4.
Okay, kind of that school day, you know. So really wonderful that this is available to families in the area. Thank you so much for being here to explain it. We appreciate it.
Thank you for having me.
Absolutely.